Well, hello, everybody, and welcome today to our webinar on ergonomics, employee health, and data-driven decision-making. We're super excited to speak with Christy Elton, the Director of System-wide Healthcare Safety at the University of California, Office of the President. Christy is passionate about occupational health and injury prevention, as you'll see, and has a wealth of knowledge in this area. My name is Maura Heilman, and I am the Healthcare Program Manager for Risk and Safety Solutions. And I am joined today by Tom Patterson, our Customer Success Team Representative and Tech Guru, and Stephen Roper, our Customer Engagement Specialist. Okay, so why are we talking about this today? Well, musculoskeletal disorders continue to result in more lost days of work than any type of injury or illness claim. And companies are noticing a significant impact on their bottom line from this and are developing programs to address ergonomics and wellness. Also, the landscape of work has changed in the past 3 years. More people are working remote, sharing desks, standing longer and on a lot of Zoom calls. So that impacts their ergonomics hourly. And there's also a tremendous amount of innovation in this area with advances of AI and wearables. And we're getting involved in that. We'll share a little bit of that, the collaboration we're doing there. So folks are just increasingly using technology to manage their safety processes. And it's just more efficient, it streamlines things, and it's easier to access metrics and reporting. So most institutions are moving off of paper and moving to online solutions. And I just think it's a really good time for us to share the work that we've done and the successes that we've had at UC, in addition to some challenges as we continue to work together to make better technology solutions to help with occupational health. So we hope that you have 1 or 2 takeaways from this webinar that will assist you with your ergonomics program and improving employee health in the future. So let's get started. I'm excited to introduce Christy Elton. Christy, can you tell us a little bit about how you got into occupational health and what your current role is at UC and what that's all about?
Certainly. Thanks, Maura. Good morning, everybody. I began my professional career actually as a physical therapist in orthopedics, but after 12 years, I kind of tired of treating the same injuries over and over. So I decided to join the efforts to prevent them. I started at the university as an ergonomics program manager at one of our campuses, and then shortly took on a system-wide role in ergonomics. Fast forward, I expanded my role to occupational safety and injury prevention, and I'm now in a leadership role where I can leverage my healthcare background as well as my occupational safety expertise.
Thank you, Christy. So what would you say the biggest challenges are facing the University of California right now with respect to MSDs and injury claims?
So what I would say is I think the top challenges for the university are really centered around the university's size and diversity. Each of our campuses is like a small or large, depending which campus, city, and we have such a diverse workforce. If you think about it, we've got faculty, we have researchers, we conduct cutting-edge healthcare, we have food service, custodians, police and fire, we have agriculture, we have scuba divers doing research way underwater. So we actually get a little bit of everything, from injuries related to the use of endoscopes in surgery to just the disposal of trash at our facilities. Our workforce includes everything from a Nobel laureate to a service worker. You can also add in there the fact that we have, like everybody else, we have limited funding and resources. All of our departments are trying to do more with less. So I think really, a lot of our challenges are focused around those issues.
Thanks, Christy. I know it is such a big system, and we do have the academic med centers and the campuses. How are they different? What are the ergonomic risks between the two entities? How do they differ?
So this slide can provide some insight to that. It depicts the top 5 occupational groups with musculoskeletal injuries at the campuses on the left and at the health system on the right. The risks are really different because the working environment and the job tasks are different. As you can see, there's some similarities. Computer users or administrative work and custodians are in our top 5 at both our academic campuses and our medical centers. But if you look at the campus graphic, you'll see that food service and facilities, including groundskeeping and agriculture, have a significant number of musculoskeletal injuries as well. On the health side, I think that the delivery of patient care is really what drives these injuries. Our nurses, our technicians, our care partners, our transporters, all of these folks have direct patient care responsibilities leading to these musculoskeletal injuries. And while we're talking about top 5, this slide, we can also look at what our employees are doing when they're injured and what body parts are predominantly injured. If we look at the graphic on the right, I'd like to point out one thing that's not clear on here. Work duties is our inclusive term for repetitive motion in our workers' comp database. I will say I do believe there's a smattering of other than additional causes other than repetitive motion, but typically that's where our repetitive motion injuries go. So if you look, predominantly it's repetitive motion causing our ergonomic injuries or our musculoskeletal injuries. Excuse me. If we, I'd also like to point out something noteworthy that a little over 1/3 of our injuries are related to manual material handling. So lifting, pushing, pulling, which hit the top 5, but also carrying, which is not in the top 5 causes of ergonomic injuries. But when you cluster that together to define manual material handling, those 3 activities, lifting and lowering, pushing and pulling, and carrying, make up over 1/3 of our soft tissue injuries at the university.
So we've talked about the demographics of musculoskeletal injuries, but what about the big question? How much is this costing? Like, what is the cost of these injuries?
Well, that is the big question. The direct cost of these claims over a 6-year period of time, we just recently did an analysis of our soft tissue injuries related to ergonomic risks. And the cost is more than $140 million over 6 years for the enterprise as a whole. And that doesn't even include our direct costs. As you know, those can sometimes be 2 to 3 times greater than your direct costs. So I've got an example here up on the slide. I'm on the healthcare side, so I've used nursing. I think it's a great example of looking at our indirect costs. So let's say that we have a nurse that has a back injury and she or he is taken off of work. As you know, most nurses work a 12-hour shift. So that's their work day is 12 hours and not the traditional 8 hours. I reviewed our system-wide data, as I just mentioned, for a 6-year period and found that nursing services averages about 1,800 lost days per year due to musculoskeletal injuries related to ergonomic risk factors. Additionally, I Googled nurse salaries in California. I wanted to use something, I didn't want to make up a number, but I found a reference that cited $60 an hour is the average hourly wage for a nurse. I think that's probably on the low end, but just to keep things simple, let's use that. And then when a nurse is out, we still need to provide patient care. So how do we do that? We bring in a replacement nurse. So typically we'll use temporary services or registries for that. for which we pay roughly $200 an hour for that replacement nurse. So $260 an hour is the cost of having a nurse out. So if we use those numbers, we can calculate the cost of a single nurse missing one 12-hour shift due to that back injury at $3,120. That's a lot of money. And then if you look at our average of 1,800 lost days per year due to ergonomic injuries, we come up with more than $5.6 million a year in these indirect costs. Now, keep in mind, this is just salary. This is not other indirect costs like presenteeism or training or, having to bring your registry staff up to speed. This is just salaries. $5.6 million a year in salaries we're paying when we have nurses missing work because of musculoskeletal injuries.
Wow, Christy, that is enlightening. Really. Thanks for sharing that example. So I know that UC has been using an online ergonomic solution for many years to try to get ahead of this, but decided to collaborate with us to develop a new commercial solution. Can you speak to your involvement in that process?
Sure. It was truly a collaboration among several groups, most notably the ergonomists at each of our UC locations, the Office of the President. I represented the Office of the President, and then obviously all of you at Risk and Safety Solutions. I was the UCOP sponsor for the project, and I primarily ensured that necessary resources were available to stay on track and to complete this project. I worked with all of the university ergonomists initially to draft a scope of work document. So we held a meeting and everybody got to, we just started basically throwing Post-its up on the screen of what sort of functionality do we need to have in this product. We then organized those into our must-haves, our want-to-haves, and our nice-to-haves. And created a formal scope of work document that we shared with the project manager from Risk and Safety Solutions. The other thing we did is create 2 ergo volunteers that served as project champions throughout the entire process. So these 2 ergonomists really took the lead, and together the 3 of us made high-level decisions for the project, but we were sort of also the glue that kept it together. The other thing the last thing we did is create a sort of a sign-up sheet online for all of the ergonomists to participate. I firmly believe that if you help build it, you will own it. So I think that the way to have a successful product is to allow your subject matter experts to build it with you. So we kind of voluntold all of the ergonomists that they needed to participate in at least one portion of this product. So, the administrative portal, developing that, developing the self-assessment, developing the training, developing the communication functionality, developing the ergonomic evaluation template. So everybody was involved in at least 1 or 2 of the components of the product. And then, as I said before, the 2 ergo champions and myself, we were the glue that kind of made sure everybody, all the pieces were working together. But we also made some of those high-level decisions moving forward with things. Excuse me. I really think, though, it was really fascinating how we were able to capitalize on the experience of more than 30 ergonomists in the system. I think that's probably what I think shines through on this is, I don't know how companies build their technology and their products, but we were actually able to build it with our customers. And I think that that's what really made this successful. I know that your team at Risk and Safety Solutions, you guys also collaborated with the ergonomists. Do you want to share a little bit about that?
Sure. Having access to that group of experts was so beneficial for us. We're an agile development shop, which means we build things and we iterate and we get feedback constantly. So having those product champions to say, hey, you're doing the right thing, you're building this right, or you need to tweak this, was a huge time savings in terms of getting this product out quickly. The work group participation, having those folks to be able to help with user acceptance testing and putting together pilot groups to actually review the building blocks before we put the whole thing together, really, I think, made it such a special product.
I would agree with that.
Yeah,
I spoke earlier about the size and the diversity of the enterprise being two of our primary challenges with respect to injuries. I think that those two factors also make it challenging to have a unified approach to anything across the system. And I'd like to kind of talk about that a little bit. I always refer to my job as herding cats. You know, I have 18 locations that I serve, 5 primary in the healthcare side, but you know, we have 18 locations. So getting 18 different programs on the same page it's virtually impossible. And so I think that the positive outcome from building this was where we couldn't get the ergonomists or the programs or the locations to agree on something, we built flexibility into the product where we couldn't necessarily reach that agreement. For example, the self-assessment, and we'll show you all a little bit about that in a bit, but the self-assessment has a core set of questions. We provide the flexibility to each location to add questions if they want, but everybody across the system has a core set of questions that are required as their self-assessment. And what this does is it allows us to benchmark internally, but give the location some flexibility if there's particular information they want to collect during that self-assessment.
So then, can you discuss some of the key features of the solution and how they can be used to manage a program?
Sure. Really, I look at it as there's 3 primary components to the solution. Office ergonomics training, there's a self-assessment, and then there's tools and resources for a professional or an evaluator to do an ergonomic evaluation. One of the key recommendations we had from employees was to ensure that the end user experience was brief but impactful. So when we were using our commercial products before we built this, one of the big complaints was the amount of time that it took to go through the process of training and a self-assessment. So to really make it brief but impactful, we created the ability for the training to be integrated into the self-assessment. For example, if I indicate that my monitor is at the appropriate height, distance, and position, I may not have to do anything about it. But if I indicate potential risk associated with my monitor, I receive a little outcome or a pop-up or a link that shows that's a link to a short video on monitor position that instructs me step by step on how to position my monitor to minimize ergonomic risk. Alternatively, if the ergonomics program manager wants, they can choose to have end users view all of the videos regardless of their responses. So if they want to provide all that information to each of their employees, they can organize the solution to fit those needs as well. A third option might be to provide the entire of videos to the employee, then request they complete it. So you can sit through the training, then do self-assessment. You can do your self-assessment, then go through the training, or you can have it integrated throughout the self-assessment. Almost everything in the product is customizable. The recommendations or the outcomes from the self-assessment can be customized to match your program processes. So we have, as I mentioned, 18 locations, which means we have 18 different ways to manage a computer ergonomics program. And this is one of the ways we can accommodate each of those different management styles. Other features manage the busy work as well. So such as assigning the program to employees and automating communications. How much of our time do we spend sending out communications on little detailed information? So this program can help automate some of that for us. There's a program dashboard as well as a system-wide dashboard, but I want to kind of push the pause on that because I'll talk more about that later. As I stated on the previous slide, everything is customizable. Customizations in the self-assessment include developing your own questions. As I stated, the university ergonomist created the questions for the self-assessment. Others are welcome to use what we created or create your own. Sometimes you have a really unique work environment and you might need your own set of questions in there. Excuse me, you can change the images. We chose to go with these sort of graphics rather than photos of real individuals, but you can always put your own photos in there. You can change the response options to questions. We basically give you a starting point to edit, or you can completely scratch that and create your own. We also assign risk to the questions within the self-assessment. That's what allows us, that kind of drives our process. And you could, if you don't agree with the risk of a question, you can change that, or you can choose not to assign risk. You can just simply collect information on the self-assessment. But the outcomes, I think, are really the key piece of this for customization. It really helps. You can really help it support your own process. So for example, I'm going to go down to elbow position in the image we have on the screen. And really what this talks about is, what is the height of your workstation? Is it appropriate? Is it too high or is it too low? So you can see here that someone indicated that their workstation is too low. And we've got a link to the training here. And then we've also got instructions on what they, how they can help themselves and address those ergonomic risks that they've identified. This is the detailed report. So when an employee finishes the training and the self-assessment, the detailed report is really a summary of the employee's self-identified risk factors based on their responses to the self-assessment questions. Only the ergonomist, I do want to point this out, only the ergonomist sees the overall score. So if you look up in the top right corner, and obviously no one can see me circling this with my mouse, but it says moderate risk 6.68. The employee doesn't see that. Only the ergonomist sees that. And I'll talk why in a little bit later, why that's important. But as you can see in this example, Maura's overall risk score is 6.68. The green 7.4 with the arrow indicates that her overall risk score has decreased as a result of her taking action to improve the ergonomics of her workstation. If we look in the middle of the screen here, the individual risks are identified in the detail report as well. You'll see on the second question that Maura has indicated she wears corrective lenses, which cause her to tilt her head back to view the screen. She can see that this is an ergonomic risk, and the information provided explains to her how her head and neck should be positioned and how she can change the components of her workstation to attain this posture. You'll also see a link to a video that gives step-by-step instructions on how to adjust her monitor so that her head and neck are in a more desirable posture. This is the management view for the ergonomics professional, either the evaluator or the program manager. It's a list of employees who have been assigned, have started, or have completed a self-assessment. This view allows you to monitor the status of your workload as an ergonomist. You know, you can filter this data by who's completed it. That's a great thing to do to report up on your productivity or your effectiveness in your ergonomics program. You can filter it by who's been assigned. So assigned means you've assigned the training and self-assessment to someone, but they haven't started it yet. So you could filter it by those folks and then just send out a mass email to them and say, hey, this has been assigned, but I noticed you haven't started it. You know, please complete this at your earliest convenience. You can also filter it by those who have started it. And I don't see that this view has that, but if someone has started it but not yet completed it, you can filter by that and send them reminders to finish the program. But the other thing I want to point out is on the far right, the column, the risk score. This allows you to triage and prioritize those more important cases. So you could actually filter this, you know, by highest to lowest score. And so your tops, you know, your highest scores are your highest risks. So you could filter this and look to see, okay, who do I really, really need to reach out to sooner than later? And you can kind of look at that to help, like I said, triage and then prioritize your cases. This is the dashboard and reporting function of this. I love this. I love these widgets. There's so many in there, and you can look at all sorts of things. So with anything, with any dashboard, the more data you get in there, the more helpful information you're going to get from it. But this is a robust analytics and reporting dashboard that can really help ergonomics program managers and administrators locate high-risk areas within their organization. This is also a really, really helpful tool for, like I said, reporting to leadership, reporting to your workers' comp or your EH&S directors, so that they have an idea of what's going on in the realm of office ergonomics. With this, you can also pinpoint high-risk individuals to address potential injuries before they happen. Follow through is also really easy with these automated notifications that we talked about earlier through the initial assessment. So you can identify who you need to reach out to, automate those communications, and then have them go back in and document their changes they make to their workstation. I mentioned the widgets. The widgets are, you can see the widgets across the top there, and these four with the diagrams. So different widgets that are included, and you can customize them. If you don't care how many self-assessments are in assigned status or draft status, you don't have to have that on there. But you have a widget that shows you how many self-assessments are in assigned status. So again, how many employees have you assigned this to, but they haven't even started it? How many are in draft status? How many have started it but not completed it? How many do you want to follow up with? Who are those folks? Self-assessments that are completed. Again, this is your workload metrics to report up to your director. How many ergonomics evaluations have you done? Computer evaluations have you done? And then you can also, the other things you can look at are your risk levels. So what is the risk level, low, moderate, or high, after someone completes their self-assessment? And then what is their current risk level? So you can kind of, that's your impact data point right there. It shows the ergonomic risk reduction. So Maura, she completes her self-assessment and her risk is high, but then we've completed the ergonomics process and now our risk is low. So that's pretty impactful for reporting upward too, is what is the effect of your ergonomics program? How do we quantify the risk reduction in computer ergonomics? And that's with those two widgets. Some of the other ones are top fives. So top 5 departments with high and moderate risks. top 5 departments with daily or weekly discomfort reported. So we all know that the report of discomfort or the presence of discomfort is one of our primary leading indicators to a workers' comp claim being filed. And we ask in our self-assessment, daily, weekly, monthly, or never. To me, I mean, I'm old enough. I really don't have a day where I never have discomfort, but I don't worry about monthly discomfort. We all have it. But if someone starts telling me they have weekly discomfort somewhere that they relate to their computer ergonomics, then I start to get concerned. Daily discomfort, that's my red flag. I need to get out there sooner than later before they file a workers' comp claim. Some of the others are the total number of employees that report daily or weekly pain and the body parts. So, you can really slice this data and understand, wow, my registrar's office and my accounting office, they all have neck problems. They have a high volume reporting discomfort in your neck. And then you learn, well, they all bought the same furniture. Maybe there's a trend there. And you can really address the ergonomic challenges of hundreds of employees at a time by coming to some of those conclusions and addressing just one simple thing a lot of times. Self-assessment risk levels, before and after, the risk reduction on an individual basis. So I mentioned the example of Maura, having high risk when she finished the self-assessment, but then having low risk when we complete the ergonomics process. So these dashboards and reports really can give you a keen sense of what's going on in a department, with an individual, or your entire enterprise. And then in my role at the Office of the President, I can see this data at all 18 locations. So I can see, well, as an enterprise, here's where we are. Or I can look at our campuses. I can say, UCLA and UC Santa Barbara look like this, but something odd is going on at Santa Cruz. Why do they have this spike where others don't? So I really think that strong and effective decisions are driven by data. If we don't know, we can't make decisions. So I really think this is a critical piece to this that I think we were missing previously.
So on to the ergonomic evaluation, which is led by the champions. Can you speak to this a little bit, to this part? This is not the self-assessment by the actual participant, but this is the ergonomist going in and doing the evaluation. And how is this different? What do you like about this piece of the software?
So once someone has gone through the training, gone through the self-assessment, we have a decision to make. If their self-reported ergonomic risks lead to a high risk profile, obviously, as an ergonomics professional, we should step in and do something. And a lot of times what we do is we follow it up with an ergonomic evaluation. It could be a phone call, it could be virtual over the computer, or it could be in person and taking a look at their workstation. So there's some features and some tools and resources in here that really help support the ergonomics professional when they're doing those. Sorry, Tom, can you go back? I'm talking too much, clearly. But I do want to point something out on here. I personally really like this. So this is the details section of the ergonomic evaluation. And there's not a lot here. It's what you see on the screen. It gives you the, we import, and I've just used my own because I don't mind showing or sharing my information. But we import this from our HR database. So that gets automatically populated. So that feature is available to import your employee data. But what I did want to point out is what I've circled in gold there is the notes section. So sometimes you want to write something down. You want to document something. It doesn't necessarily need to be part of the report, but you just want to document the case. And so this is where you can do that. And what I circled at the bottom, you can also make it private. So let's say Maura had a previous workers' comp injury, or let's say Maura filed 7 workers' comp injuries at her previous job, and she told me about that. I may want to remember that, but it's not necessarily something I want to share in a written report or with her supervisor or anything like that. But it might be something that's really probably important for me to remember as we move forward. So I can put that here. I can document that there and I can mark it private. The other thing you can do in this section is you can upload documents or files if you want to include those in here. So let's say they have, sometimes they'll present, I have restrictions from my doctor and here's the doctor's note and they give it to you and they want you to have that. You could put that here and mark it private. So it's part of the file, but it's not shared private information.
Christy, are you ready to move on to show the questionnaire? And
I am. I was just going to say next slide.
Awesome.
Yes. So this is really the ergonomic evaluation. This is the meat of it. So you can see this is the questionnaire section. And I'm going to direct you over to the right of the slide first. These are the 9 sections of the report. So those that are in the black font are really just information that we're collecting, but it's important information to collect. So you have the employee information, the evaluation information, discomfort observations, what you see when you walk in, a description of their workstation. What kind of mouse are they using? What kind of desk do they have? What shape is it? The condition of their equipment. Is something broken or not working right? If you're a measurements person, you can take as many measurements as you want. And then there is a section for additional information. I am one who always likes to summarize everything that I do. So I can do that in that last section. But I'm going to draw your attention to number 6, which is the section with outcomes. So that's what we have up on the left of the screen. So we've taken every component of the workstation, and I'm just going to use chair and posture support. So you can see under that, it says the chair meets the employee's ergonomic needs. If I say no, it does not, I open an incident. So I'll show you the incident screen in a moment. But what that essentially does is, you know what, let's go ahead and open it, or go ahead and change slides, because I'll talk about that on the next slide. There we go. So these action items or incidents, this is derived from those questions we saw on the previous screen, that a component of the workstation does not meet the employee's ergonomic needs. So with this incident, you can identify the risk. What is the risk? Is the chair too small? Is it too big? Is it not providing enough back support? You can provide an action plan. What are you recommending that we do to address this risk? You can also create a due date. And that's really nice, because how many times have you made a recommendation and then you let it go, but it never happened? So with due dates, it gives you these prompts or ticklers to follow up on open action items. You can upload files. If you have a PO you want to upload, if you're recommending a new chair, if you want to upload a picture of the chair, anything you can put in there. And you can also include comments. So you could instruct them on how to order the chair or anything like that.
Christy, thank you so much for showing us the solution and the options there and the flexibility and customization. Love the graphics. So what do you see coming next in terms of ergonomics and UC?
Ooh, that's a really good question. There's a lot coming up. It's really actually pretty exciting, and I don't know what took us so long to get here. But one of the things coming very soon is related to the Office Ergonomics program. Without getting nerdy and into detail, with the Office Ergonomics program, Risk and Safety Solutions created what I call the foundation or the platform to be able to create other ergonomic evaluation tools or resources. So now that the foundation is built, we can really easily and quickly build future modules and customizations of the solution. So for example, we can easily create a lab ergonomic solution with all of the same 3 primary components: training, self-assessment, and ergonomic evaluation tools and resources. We could do the same for manual material handling, patient care, custodial duties. Remember, those are our top 5. I feel like we've built the ship. Now we just get to keep adding to it. Some of the other things that we're working on, we've recently established a really unique partnership within the university. Risk and Safety Solutions and UCOP Risk Services has partnered with the Northern California Center for Occupational and Environmental Health, as well as the Berkeley Ergonomics Lab. So the Berkeley Ergonomics Lab is run by a professor, and it's a research lab. So we have the Center for Occupational and Environmental Health, as well as ergonomics research going on within our own enterprise. With Risk and Safety Solutions, we have technology to support some of those efforts. And then with our ergonomics programs, and our occupational safety programs around the system, we have real life scenarios where we can take research concepts and ideas, apply them, and then Risk and Safety Solutions can provide the technology support to be able to do it seamlessly and really effectively. Together, we're exploring the application of technology in ergonomics and occupational health. We're in the development phase of launching some projects with smart wearables to evaluate risk factors. I'm really excited about that. We're exploring the use of machine learning or AI in occupational health and injury prevention. Other examples of this is a slide we had actually from one of our discussions around total worker health. By combining the information that we're probably already collecting through wearable smart devices and other health data points, we can begin to explore true total worker health. Imagine using AI to evaluate one's activity level, body composition, cardiovascular health, stress levels, sleep patterns, medications, occupational exposures. We can use all that information to predict injuries at work. These data points seem like a lot, but I was actually surprised listening to the computer programming folks at how much our smartphones and our smartwatches are already capturing. They're actually already especially the latest version of them. They're capturing so many of these data points. So if we could just really kind of pull all this data in, I think it's really, really exciting, what we can do with this data. Now, there's obvious challenges to work like this. Private information is probably the first red flag that everybody thinks of. But having this information could really take us to the next level in terms of total worker health and using that to address and prevent occupational injuries. I did want to point this out. This is really exciting to me. Something I didn't mention earlier about the self-assessment. As you go through and answer the questions, there's also an opportunity to upload photos of for the employee to upload photos of themselves at their workstation. It works wonderfully to aid the evaluator in better understanding the workstation fit, especially, as we all know, a lot of employees are working from home and we don't go into their home to do these evaluations. So these images or photos are really, really beneficial to understanding a workstation. But one of the problems with still images is, what's the first thing that you do when someone says, let's take a picture? You sit upright, right? You stand upright. You make sure your posture is good. It's no different having somebody take a photo of themselves at their workstation to send in with an ergonomic self-assessment they're going to sit up straight. You're going to see some of the best postures in the world with those images. The problem is that's not really representative of their posture during the workday. So this is something that one of the teams at Risk and Safety Solutions is exploring is posture detection and body mechanics. So
should we go ahead and watch the video?
Yeah, I was going to have you do that. Thank you.
Yeah.
So what he's doing is he's pulling out a piece of paper that's a known length. So once you've got something that's a known length, that helps the software calibrate the distances between 2 points. So you can see the lines at certain body points. So shoulder joint, elbow joint, wrist joint, ear, eye, hip, knee, foot. So the lines allow you to see your posture. So something that we're working on is, well, first step I think that this will do is this will allow a dynamic evaluation of someone's postures. You know, my posture at 8 o'clock looks very different than my posture at 4 o'clock. So it would be nice to have that dynamic assessment of our postures. The other thing we've talked about is giving some feedback to the employees. So, you know, where there are problems, maybe the lines go red to say, hey, this isn't a good posture. When the posture is good, the lines go green. So it's that sort of, you know, some sort of visual feedback to prompt the employee to understand what are the good postures and really prompt them to, you know, it's just those reminders that we need. And then this software can also be applied to body mechanics. So we're right now exploring with some of the ergonomists using this technology with manual material handling, looking at particular tasks that we do that involve material handling, and then also using it to train employees in proper material handling. If you recall, when we were talking about injuries, a lot of our, it was over 1/3 of our ergonomic injuries are related to manual material handling.
All right, we're just about out of time, but I think we just have one last thing we want to add here about getting in touch with us. Is that right?
Yeah, I really, Christy, thank you so much for your time today.
Thank you for the opportunity.
It was seeing all the numbers and the injury costs and all of your knowledge on ergonomics was great. And thank you for showing the software. Also, thank you for those attending and for the questions. Again, we offer technology, so if you think you might benefit from a 15-minute call with us, we'll be sending out a Calendly link, which Stephen can follow up with you in the email that we send up, follow-up email, where we'll also link out to the video if and there'll be a little survey. Please provide us your feedback if you want part 2 or part 3 of this as we gather more data and can compare it to injury data, that sort of thing. We're happy to organize that. So thank you so much, and everybody have a great rest of your week. Bye.